and that does it continuously 24/7, nonstop. If you have clog in your heart artery, if you have blockage in the heart artery, the artery which supplies blood to the heart, then the heart doesn't get enough blood flow. And that can cause the chest pain. That can cause the damage to the heart muscles, and that is called the coronary heart disease. And we're going to focus this talk on this heart disease because this is predominant form of the heart disease, and this is often preventable. There are some other form of the heart disease. If you have the weak heart muscles, it may be from the blockages in the heart artery, or it may be from some other reason. Or if you have abnormality with the valve function, then the heart may not be able to circulate blood easily, and you can have symptoms because of that. And what are the common symptoms you get? The most common symptoms from the blockages in the heart artery is a chest pain. You may feel the pressure-like sensation. You may feel the chest tightness. Sometimes you feel there's something sitting on the chest, okay? You may feel the jaw pain associated with that. Sometimes it may be associated with the left arm pain and shortness of breath. Those are the very common symptoms of the heart conditions. However, there are some of the less common symptoms, such as nausea, vomiting, heartburn. Okay, sometimes some people feel the indigestion feeling. They may have stomach pain. Okay, some people will feel the sweating and cold and clammy sensation. Okay, though there are some other explanation for these symptoms, but it could be because of the blockages in the heart artery as well. So don't ignore these symptoms. Just want to point out this important fact that the heart attack is a sudden and complete obstruction of the blood flow to the heart muscles due to clogged artery and the blood clot. And if you ignore the symptoms, it may result in significant damage to the heart muscles. It can cause cardiac arrest and it can cause death. So don't ignore the symptoms of heart attack. Okay. The other thing I want to point out is if you have mild to moderate blockage in the heart artery, if the blockage is 20 to 30% or so, you still are at risk for having heart attack, but you may not have any symptoms. Okay. So the question is, how does the heart artery blockage develops? It is a very complex process, but in simple term, it starts with damage to the inner lining of the vessel wall, and it becomes leaky. Then the cholesterol particle, it leaks through this vessel wall and deposits in this vessel wall. And that is called the plaque. So the cholesterol particle deposited in the vessel wall is a plaque. That is the early stage of the blockage. Over a period of time, you can have more and more cholesterol buildup. There may be a thickening of the vessel wall and calcium deposits. Okay. If no corrective action is taken, then the plaque will continue to grow, and the two things can happen. When the narrowing gets more than 70%, it can cause the chest pain with activities, and you may not be able to do the activities which you are doing. Sometimes this plaque can become unstable and makes the blood clot, and you may have complete occlusion of the blood flow to the heart muscles, and that is called the heart attack. Okay. I get this question many times, how long it takes for the blockage to develop, okay? It doesn't happen over a period of weeks and doesn't happen over a period of months. It takes years and years. Some studies suggest that you can have the plaque buildup, meaning that the cholesterol deposit in the heart artery when you are 10 or 20 years old, okay? When you are in 30s and 40s, this process accelerates significantly. So it's very important that we take the corrective actions from the beginning. Don't wait for a heart disease to develop. So what are the risk factors for having blockages in the heart artery? Well, we can divide those risk factors into two categories, the modifiable risk factors and non-modifiable risk factors. The non-modifiable risk factors is the risk factors for which you may not do anything about. Older age is associated with the elevated risk of heart conditions. African Americans, they have higher incidence of the risk factors such as high blood pressure and high cholesterol, and they have higher rates of heart disease. The male have higher rates of heart disease compared to the female because of the hormonal factors. If you have family history, then you are at higher risk for having heart disease, but there is nothing you can do to change these things, okay? So they are non-modifiable risk factors. And there are some modifiable risk factors for which you can do something about it. You can change them to decrease the risk of heart disease. And we can divide them into two categories. uh, the lifestyle related risk factors, meaning that the poor lifestyle, that includes smoking, physical inactivity, poor eating habits, obesity, heavy alcohol use. And there are some other diseases like high cholesterol, high blood pressures, and diabetes that will increase the risk of heart disease as well. Okay, so what to do to prevent the risk of heart disease? Okay, the number one thing you need to do is stop smoking if you are smoking. The smoking accounts for 1 in 5 deaths in the US. It is number one modifiable risk factors. The nicotine damages the arterial wall and it increases the risk of heart attack. The risk of heart attack and stroke is elevated by 2 to 4 times, okay? And the risk lowered immediately after you stop smoking, and it becomes similar to the non-smoker risk by 2 to 5 years after stopping smoking. Some people ask me many times that if the vaping is safer. No, vaping is not safer. It is also associated with heart disease. So need to stop vaping as well, okay? So you can stop smoking immediately, or some people like to just wean themselves off, gradually cut down on the smoking and then stop, okay? Any method works, you should go with it. If you think that you need some additional help, you need to talk to your doctor to see if any medication might be helpful, okay? The nicotine patch, Chantix, and Wellbutrin, they are commonly used medications and they can improve the chances of successful smoking cessation, okay? You also need to avoid secondhand smoking. It is associated with the increased risk of heart disease. The number two things you need to do is exercise, okay? The exercise, physical inactivity is associated with the increased risk of heart disease. The people who exercise have overall better health than the people who don't exercise. Exercise reduces the blood pressure. It can reduce the blood pressure by 10 points, okay? So that's significant reduction in the blood pressure. It helps with the cholesterol control. Study shows that the exercise and good diet can reduce the risk of diabetes by 30 to 50%, okay? It also reduces the risk of heart disease by half. So it's very important you exercise. What is the recommendation? You exercise at least for 30 to 45 minutes, most days a week, at least 5 to 6 days a week, okay? You can choose activity you like. It doesn't need to be complicated exercise. It doesn't need to be exercise on the machine, or you don't need the gym. You just need the shoes and place to walk, okay? If it's snowing outside, it's raining, you can walk inside the house. You can use the stairs if you have, okay? The third thing you need to do is a reduced weight. Obesity is associated with the increased diabetes, high blood pressure, high cholesterol, heart disease, and number of many other diseases. So it's very important that you control your weight. And what is going to help is regular exercise, which we talked about, and eating healthy and eating less. So need to decrease the portion of your meal. If you are eating one sandwich, just cut it to half, eat half sandwich, okay? And you need to eat healthy, and everybody knows that what is a healthy diet. So the no sugar, you should eat more vegetables and fruits and nuts. No refined grain, so no white breads and pizza dough because it has carbohydrates, no nutrients. Use whole grain products. It has high fiber and it is good for health. You need to limit the food with the high saturated fat and trans-saturated fat, okay? It increases the LDL level. That is a bad cholesterol, okay? Choose the non-fat and low-fat products. The fatty meats, such as organ meat or red meats like bacon and beef, they are not good for health. Okay, you should choose the low-fat meats, which is the white meat, includes chicken, turkey, and fish, okay? Some people ask me in the past that if the eggs are healthy for them. The egg yolk has a lot of saturated fat, so avoid excessive use of egg yolk, okay? Eat oily fish, salmon, trout, tuna, herrings. They are good for health. That will increase the HDL level, which is the good cholesterol, okay? You need to avoid the high-fat dairy products, such as whole milk, cream, ice cream, and use the skimmed milk instead. Avoid solid fats, such as butter and cheese, and use liquid vegetable oils, such as olive oils or so. Avoid frying Grill and baking is better than frying. It is associated with lower high saturated fat. If you are drinking, then you should limit the alcohol use, 1 to 2 drinks per day, and occasional drinking. Okay. So number 5th rule is you need to know your number. You need to know what your cholesterol level is. You need to know what your blood pressure, and you need to know what your blood sugar level is. Okay, because all these things will increase the risk of heart disease. And you may not have any symptoms even though they are abnormal. Okay, so you need the periodic monitoring. Okay, you need to check them at least once a year. Okay, regular exercise, good diet, and weight reduction will help with all 3. Okay, some people say that regular exercise and weight reduction is similar to taking 1 medication for all 3 disease. Okay, so it's very important. In terms of the diet, low saturated fat and transaturated fat diet will reduce the LDL cholesterol, which is the bad cholesterol, and help with the HDL cholesterol that will increase the HDL cholesterol, which is a good cholesterol. For high blood pressure, you need to have the salt restriction. Okay, so the recommendations is less than 1500 milligrams of sodium or less than 1 teaspoon. Okay, you need to avoid sugar if you have diabetes. If it's not controlled with these conservative measures, then you need to be on the medications. But you need to keep your cholesterol less than 200, bad cholesterol, which is LDL cholesterol, less than 100, and blood pressure less than 130/80. You need to keep the hemoglobin A1C less than 6%. Okay. Now, if you have question that how do you estimate the risk of heart attack and stroke, you or your physician can use the simple online calculator, okay, the ASCVD risk estimator that is applicable for the patients between age 40 and 75. It is simple, free online calculator, and it is recommended by American Heart Association. And if you Google it, and if you click on the link, then you may see the window like this, okay? Here, we're gonna do the exercise for, and we're gonna estimate the risk of heart attack and stroke for Mr. X. So Mr. X is 55-year-old male. He is overweight. He eats anything he gets. He doesn't eat healthy. He doesn't exercise. His cholesterol is a little bit elevated at 230, not terrible. His blood pressure is high, 148. He smokes half pack a day, and he wants to know his risk of heart attack and stroke. So he opens this online calculator. He puts this number. He's a male. He's 55. He's white. His cholesterol is 230. His blood pressure is 148. He doesn't have diabetes. He smokes, and he's not taking any medications for blood pressures. And he checks his risk. So his risk for having heart attack and stroke over the next 10 years is 18.4%. So by the time he will be 65, there's a 20% chance that he will have the stroke or heart attack, and those are the life-changing events. Okay, if you click here on the recommendations at the bottom of the screen, then it can give you the recommendations like this. So this is the recommendations for Mr. X, that he is at higher risk for stroke and heart attack. So he needs to be on the moderate intensity statin, okay? He needs to be on the moderate intensity statin that will reduce the risk of stroke and heart attack. He also needs to follow up with a good lifestyle, okay? So what he does, he gets worried and he stops smoking. He doesn't do anything else. He stops smoking, okay? He doesn't do anything else. He just stops smoking, and he checks his risk of heart attack and stroke. Everything else is the same, okay? So cholesterol is the same, the blood pressure is the same, but he just stopped smoking, and his risk of heart attack and stroke is now 10.2%. So he reduced his risk of heart attack and stroke only by stopping smoking from 20% to 10%. So it has very powerful effect, okay? So it's so important that if you are smoking, then stop smoking. He also lost some weight he started healthy diet, he does regular exercise, his cholesterol is better, his blood pressure is better, and now his risk of heart attack and stroke is around 3.9%. So significant reduction in his risk by doing the right things. So what else you can do to know the risk of heart attack? Well, you can do the coronary calcium score. What it is it is a rough CT scan, and it shows calcium in the heart artery. It estimates the burden of the plaque buildup. Okay, it does not show the narrowing of the heart artery, but it can estimate the burden of the plaque buildup. The higher the calcium deposits in the heart, more the plaque burden you will have. Okay, it is useful when you're never diagnosed with the heart artery blockages and the risk of heart attack is uncertain. Okay, so here you can see in this example that this person, this is a heart, and here is the heart artery, and you can see that there is no calcium in the heart artery. So this person's calcium score is 0. Okay, if you see this example at the bottom, you can see a lot of calcium here in the heart artery, and the calcium score is around 1200. So this person is at significantly higher risk for having blockages in the heart artery. And this person will benefit from the cholesterol medications such as statins, simvastatin, or Lipitor, or Crestor. And this person may also need further testing to see if he has significant narrowing in the heart artery. And how do we find out if the person has significant narrowing in the heart artery or not? Okay, so we do the exercise stress testing. We do it when there is an elevated risk for significant narrowing of the heart artery, or if somebody has chest pain and if you're not sure why the person has the chest pain. So what you do is you walk on the treadmill, you'll be connected with this ECG machine, and we will also check your blood pressure. And we continuously monitor the ECG and see if there is any significant changes, like you can see it here, that may suggest the significant narrowing of the heart artery. We can sometimes combine this stress test with the echocardiogram, ultrasound of the heart. We put the gel on the chest and take a picture of the heart from different angles and see if after the exercise, if the heart function or wall motion is affected, and that may sometimes suggest the blockages in the heart artery. We can also do the nuclear stress test, here the nuclear stress test can be done with the exercise treadmill stress test, or it can be chemical stress test. We give you the medicine to induce the stress on the heart, so you don't have to walk on the treadmill. And then we take the pictures with the camera before and after the stress test and see how is the blood flow to the heart. Here you can see at the bottom, at the rest, everything light up well. So meaning that the blood flow was good, but during the stress, this part of the heart did not light up as good as at the rest. So there may be a blockage in the heart artery, and this person will need additional testing. Okay. The other thing we can do is CT coronary angiogram. This is not similar to the calcium scoring. This is one particular type of the CT scan. We do it in the office. We put the IV line, we give it the iodine contrast, and once the iodine contrast reaches the heart artery, we do the CT scan. And it can give us picture like that. Like here, you can see in this example that there is no significant narrowing. There is some calcium, so there may be a mild blockage there, but there is no significant narrowing. On this example, you can see that there is a significant narrowing here in this mid segment. Okay, so this person will need the additional testing, and the next step would be the heart catheterization. The heart catheterization is a final and gold standard to see if you do have the blockage or if you don't have the blockage. Okay, we do it in the hospital. It is an outpatient procedure. It takes 30 to 40 minutes to look for the blockage. We insert small spaghetti noodle size catheter in the wrist artery, or sometimes we insert it from the groin artery. Like here in this cartoon, you can see that this catheter goes all the way up to the heart. And once it reaches to the heart artery, we inject the contrast dye. And then we take the pictures with the camera rotating around you in different angle and see how that dye flows. Okay. As I mentioned that we can do it from the groin or we can do it from the wrist. But lately, we like to do it from the wrist because it is much safer, more convenient, and lower risk of complications, okay? When we inject the contrast dye and take the pictures, we can see something like that. Here you can see the catheters. Here is a dye we are injecting in the heart artery. And in this example, you can see in the first example, you can see that there is no blockage. Everything looks pretty smooth, okay? This person, the second person, has some mild narrowing, some irregularities here, maybe 10 to 20% blockages. So this person doesn't need to have the stent to open this blockage, but this person needs to be on the medications for the heart artery blockages, okay? Here in the third example, you can see that there is a significant narrowing in the heart artery. So this one needs to be opened with the stent. And with using the same catheter and using same access, we can open those blockages with the stent. This is a case we did last week. The person has a chest pain. We did the heart catheterization. It shows that there was 95% narrowing here, okay? So we insert the wire, we insert the balloon and stent on top of the wire, and we open that stent, okay? The stent will stay there. It will keep that blockage open. And here you can see after we fix that with the stent, it looks good. There is no more blockage in that area of the heart artery, and there was good blood flow to the heart. Now, once you diagnose with the blockage, what you need to do, okay? What you need to do is things you need to do to prevent the progression of the blockages and reduce the risk of heart attack, okay? Lifestyle changes are very important, okay? It reduces the risk of heart attack and reduces the plaque burden, okay? This is the study we did when I was at Washington Hospital Center. And what the study shows that the patients who did the right thing, they stopped smoking, did regular exercise, and they followed the healthy diet and reduced the weight. They had some reduction in the plaque burden in the neck artery as well as in the heart artery, okay? So it's very important that you make the good lifestyle choices. The statin, the cholesterol medications is also very important, okay? Irrespective of what your cholesterol level is, we will put you on the cholesterol medications if you do have significant blockages in the heart artery or if you are at high risk for having heart attack or stroke, because these medications will reduce the risk of heart attack and stroke. It will prevent the progression of the blockages. And some study shows that it may reduce the blockages as well, okay? You need to make sure that your diabetes is controlled, your high blood pressure is controlled, and high cholesterol is controlled. You need to see your primary doctor, you need to see the heart doctor to make sure that these things are controlled well, okay? And the last thing I wanna talk about is aspirin, because I get these questions many times. If the aspirin good for me or not, okay? So there are two uses of aspirin. The one is a secondary prevention, meaning that if you ever had heart attack, if you ever had stroke, or if you ever had stent because of the blockage in the heart artery, then yes, you need to be on the aspirin, and you need to be on aspirin for your life, okay? It may be aspirin or some similar medication like clopidogrel, but you need to be on that, okay? If you never had heart problems, but there is an elevated risk of heart attack and stroke, then it's a little bit controversial. The newer study shows that it does decrease the risk of stroke and heart attack, okay? Aspirin will decrease the risk of stroke and heart attack, but it will increase the risk of bleeding, okay? So the benefit evens out. So what I tell my patients is if the risk of bleeding is lower, if the patient is tolerating aspirin, and if the risk of heart attack and stroke is significantly higher, then it may be reasonable to consider the 81 milligrams of aspirin, okay? And you just need to be on aspirin 81 milligram, baby aspirin, okay? And this is preferred. 325 milligrams of aspirin is not preferred per guideline, okay? So you need to be on baby aspirin. And with that, I'm gonna summarize. To prevent the progression of the blockages in the heart artery and to decrease the risk of heart attack, Important that you stop smoking if you are smoking. Important that you made good, healthy lifestyle choices. Manage your diabetes, high cholesterol, and high blood pressure. The statin therapy may be beneficial for selected patients, and aspirin for selected patients if the risk of bleeding is lower. Again, if you are young and if you have symptoms, don't ignore the symptoms. Okay, it may still be because of the heart conditions. If you have any symptoms such as chest pain, difficulty breathing, swelling in the leg, feeling fatigued, tired, feeling heart racing, then don't ignore these symptoms. Seek medical attention. Okay. Sometimes you can have atypical symptoms such as acid reflux, indigestion feeling, pain in the belly. Okay, so don't ignore these symptoms. And if you think that you are having heart attack, then don't wait. Okay, call 911, because if you wait, it can result in significant damage to the heart muscles. Okay, and with that, we'll take the questions. These are my two daughters. One is 5-year-old and one is 1.5-month-old. And also wanted to point out that I do have the treadmill at the back. Thank you for listening, and we'll get to some questions here. Okay. So the first question is, what are the thoughts on removing dairy products completely from the diet? This is a very particular question. You may need some dairy products, but you can use the skimmed milk. If you don't want to use the dairy products, there are some good alternatives like soy milk. You can use that. The soy also has good protein. So you can use that. Okay. The next question is if I can share the link for the risk calculators. Yes, I will share the link for the risk calculators at the end of these questions. Okay. The another question is, if somebody is on cholesterol and blood pressure medications but continue to eat a lot of salt, fat, and sweets, the medication, if the medication will work or not. I think that's a question. Yeah, so it would be just need to maintain the balance. Okay. If you eat a lot of salt, then your blood pressure will go high. Okay. The medication may work, but then you may require 3 or 4 medications. Okay. It will be the same for the fat and sweets. If you are taking medications for high cholesterol, and if you are eating a lot of fatty stuff, and if you are taking medications for diabetes, and if you are eating a lot of sweet things, then they will not be, the cholesterol and diabetes will not be well controlled. So to control it optimally, it is very important that you follow the good diet. And after that, if you need, then add the medications. The next question is, what are the risks of eating raw garlic with coriander leaves? That is the particular questions. I'm not sure about it. So I think if you have that questions, it is better that you talk to the nutritionist, who will be more experts in and the garlic is a blood thinner. So the garlic is a blood thinner too. Should we then have the aspirin 81 milligrams or not? Okay, so the garlic, some studies suggest that the garlic may thin the blood, but we don't recommend it. We don't recommend the garlic for that particular reason. Okay, so we don't have any good recommendations on the garlic. But as we talked about, if you do have the heart conditions, or if you have a history of stroke and heart attack, then you need to be on aspirin. And if you are at risk for having heart attack and stroke, then you need to talk to your doctor to see if the aspirin would be a good option for you, because as I said, that it will reduce the risk of heart attack and stroke, but it will increase the risk of bleeding. And the next question is, does the VCS have a nutritionist on site? I do not believe that we have nutritionists on site, but if you want, then we can we can refer you to the nutritionist affiliated with the hospitals. And those are the questions we have. And I will share the link for the risk calculator in a second.